So I'm Dr. James Meschia here to introduce Dr. Natalia Rost, who will be describing her work on the genetics of white matter disease. Dr. Rost, could you introduce yourself for the folks out?
Hello, my name is Natalia Rost and I'm a vascular neurologist at the Massachusetts General Hospital. We have a presentation at the ANA which is named Genetic Variants that are associated with white matter hyperintensity predict risk of ischemic stroke. And I'm happy to present this work today.
Good. I was wondering if you could give our audience a sense of the dilemma that they face today with white matter disease.
White matter hyperintensity, which is the neuroimaging phenotype that they've been studying in this particular work, is actually a very common finding in the patients who present with ischemic stroke or hemorrhagic stroke to the hospital, but also a common finding in healthy aging adults. This finding has been associated with the risk of cognitive decline, gait abnormalities, and also late life depression in aging adults, and is certainly a significant predictor of ischemic stroke in this population.
So what sort of innovation does your research bring to this question?
In this large study, in collaboration with over 12 centers, we've been able to bring together neuroimaging, genome-wide genotyping, and as well as novel statistical methods to look at the association between the neuroimaging phenotypes that are associated with ischemic stroke, and also the risk of ischemic stroke in the population. So in a sense, what we've done is we've discovered the genetic variants that are associated with leukoaraiosis or white matter hyperintensity in patients with stroke, and we've been able to take it across the cohorts into healthy aging adults of the Framingham Heart Study to see if these variants were actually predictive of ischemic stroke in these patients.
I was wondering if there are certain methodologic challenges related to measuring white matter disease across multiple centers.
There certainly are, and they stem from the fact that the images that we've used in our analysis are clinical images. These are images that come from the patients who come to the hospital with acute ischemic stroke at the time of the enrollment into their study. And these images had to be processed in a way that allowed for very strict quality control criteria, as well as developing validated volumetric protocols to assess white matter hyperintensity. We then had to deal with all of the challenges of genome-wide association testing, which includes multiple testing, population stratification issues, and also issues of bringing together data from different sites that otherwise differs in phenotype collection, et cetera, et cetera. But we've done a good effort on that.
Excellent. So what would you say the main finding is of your work at the moment, and also what you would expect to perhaps down the line, if you wouldn't mind crystal balling it a little to tell our audience what you would expect to find down the line?
So in the essence, and as a result of a large meta-analysis which includes over 2,500 people, both from the US-based centers, UK, European and Australian colleagues, we've been able to demonstrate that common genetic variants that are associated with leukoaraiosis or white matter hyperintensity in patients with stroke actually predict the risk of ischemic stroke in otherwise healthy aging adults who were participants of the Framingham Heart Study. This is actually a very important finding because it is really a proof of concept that these common genetic variants may be contributing both to the risk of the disease in healthy individuals as well as those who present to the hospital. And I think if we understand that these are the processes that kind of stem back to original predisposition or susceptibility in the form of DNA, we'll be able to further disentangle the pathways and biological mechanisms that may be responsible for both of the processes.
Do you have a hope or expectation that they might lead to new drug targets?
This is the ultimate hope, and we're certainly far away from that at this stage. But in science, things work out with variable success, and who knows if it'll take another smart investigator and some other center or a collaborator who would come up with inventive ways to take that onto the path to who knows, pharmacogenomics or disentangling these mechanisms.
Well, thank you for taking the time to be interviewed, and congratulations on your work.
Thank you so much.